My name is Malin Hultcrantz. I'm one of the attendings in the myeloma service at Memorial Sloan Kettering in New York. And this year at ASH, I'll be presenting a poster on our investigator-initiated trial on Belantamab mafodotin, pomalidomide, and Nirogacestat. This trial builds on the rationale builds on one of the reported mechanisms of resistance to BCMA and Belantamab mafodotin, and as that is that BCMA, which is expressed on the cell surface, is cut off or shed from the cell surface by an enzyme called gamma secretase. So the rationale here is to do a combination with a gamma secretase inhibitor called Nirogacestat, so we will have more BCMA on the cell surface that then Belantamab can combine to. So the trial was a combination of these three drugs. We also added pomalidomide to dose cohorts 2 and 3. And the dosing schedule was to start with Nirogacestat, then add Belantamab every 3 weeks for 3 cycles, and then every 6 weeks after that. So for the results, what we saw when we pre-treated first with Nirogacestat, we looked at the BCMA expression before and after this pre-treatment, and we saw that for most patients, we actually saw a significant increase in the BCMA on the cell surface. So we then treated with Belantamab, and then, as I said, with pomalidomide as well. So in dose cohort 1, which was Belantamab 1.0, we didn't see, that was a little bit too low, but for dose cohort 2 and 3, which was Belantamab 1.5 and 1.9 milligrams per kilogram, there were 6 patients that were treated, all responded. So everyone achieved a PR or better. So there are 3 patients with a partial response, 3 patients with a very good partial response. As for the side effects, we always think about the keratopathy with Belantamab. We did see that also, even though we used the lower doses than the FDA-approved levels. So we did see 66% of everyone had an ocular toxicity. There were 2 patients, so 33% had grade 3. All of these resolved either to grade 0, so complete resolution, or to grade 1. The other side effect that we saw was from Nirogacestat, where we saw some GI side effects, primarily diarrhea, which we also could manage them with dose reductions. So if we summarize the trial, we saw high response rates in the dose levels of 2 and 3 with pomalidomide. We did see some of the ocular toxicities, and I think that overall, Belantamab is a clinically effective drug, and I think a lot of these side effects can be managed if we upfront use a bit lower doses and longer dose intervals overall.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.